In part 2, I will describe background questions to ask depending upon the classification of the caller's question, and I will define specific sections of the resource to consult depending upon the type of question asked. So our goal in answering drug information questions is to find the answer effectively and efficiently. We want to use the systematic approach. We want to ask appropriate background questions, and we want to consult the section of the resource most likely to contain the answer. When answering a question about an adverse drug reaction, there are several things you will need to take into consideration. Something that you should always come to mind is whether or not a patient is involved. If a patient is involved, you will need to determine the urgency of the situation. You should consider the following questions. What is the suspected drug and dosage? What is the time and duration of the adverse event? What is the time relationship between starting and stopping the drug and the adverse event? What are the names, dosage, and route for all drugs currently and recently prescribed? What are the patient's specifics, age, sex, height, weight, organ dysfunction, and indication for drug use? Has the patient experienced this adverse event with this drug or a similar agent previously? Was the suspected drug ever administered before? Why was it discontinued then? What were the events findings that characterized this adverse drug reaction, such as the onset, duration, etc.? Has any intervention been initiated at this time? Is there a family history for this adverse reaction or drug allergy? So an example is a physician calls and basically wants to know if Cardura causes gynecomastia. A physician who works in the clinic calls, I currently have a patient in my office and he complains of breast enlargement. Does Cardura cause gynecomastia? The patient takes OTC cimetidine for heartburn, and the patient had noticed his breast a bit enlarged and was wondering about this. What should you tell the physician? Before you answer this question, you need to consider other questions to ask the physician. You need to know why the patient is taking Cardura and what is the dosage. How long has the patient been taking Cardura? You'd also want to confirm that the patient is not on any other medications or herbal therapies. And the same about the cimetidine. Why is the patient taking cimetidine? What is the dosage of cimetidine? And how long has the patient been taking cimetidine? So you find out that the patient is taking Cardura 2 milligrams once daily for hypertension. And he's been taking the Cardura for 2 months. You know from the physician's description that the breast enlargement just started approximately a week or so ago, but not 2 months ago. That cimetidine, though, he's been taking for heartburn for about 6 weeks now, and he's been taking 600 milligrams 3 times a day. So that gives you a basis of information to begin your search. In your search, let's start with facts and comparisons. I know that Facts and Comparisons has a drug search by disease or symptom tool database. So what I want to do is click on this tool, and I want to find drugs that may cause, and then I'm going to add gynecomastia. So as you can see, I have a window now that says I'm going to find drugs that may cause this adverse reaction, gynecomastia. I could limit my drug to cimetidine or Cardura, but right now I'm just going to hit go to see how many results I get. And as you see, quite a few medications come up here. So if I go to Modify Criteria, I can add my drug. Cardora, cimetidine. Then I can hit Go. And I can see that both of these drugs have been linked to gynecomastia. So what I want to do is click on the hyperlink. So I click on cimetidine, and it will bring me to the monograph to where gynecomastia has been reported. So under the adverse events in endocrine, it says gynecomastia has been reported in patients treated for 1 month or longer, in patients treated for pathologic hypersecretory states. This has occurred in approximately 4% of cases. Okay, then I can just hit my back button and go to the doxazosin, Cardora. And I can see that it's been listed in post-marketing experience information. So I do know that when adverse events occur in post-marketing experience, these are generally from MedWatch or reports to the FDA from prescribers or patients or pharmacists, healthcare professionals, in which they describe an adverse event for a drug. Oftentimes it may not mean that the drug is 100% causing that event, but it has been linked to that event. So I think I may try another database. So let's go to Micromedics. And in here I don't really have a tool to identify adverse events, so I will just look up the cimetidine monograph. I always go to the detailed document. I don't usually use this drug point summary. I go to the detailed document. And now I'm going to go under adverse reactions. And then I know in facts and comparison it was listed under endocrine, so I will click on the endocrine metabolic effects. And then here again, I have a nice explanation of gynecomastia for cimetidine. Micromedics is known to summarize the primary literature. So the incidence is up to 4% in patients taking it. This looks like the same thing we read from facts and comparisons. Again, I can check the reference by clicking on the number. And I can see that this information is from the product information, Teva Pharmaceuticals. And then here's a study. So these persons were on cimetidine chronically for gastric hypersecretion. They were administered up to 10 grams daily. That's quite a large dose. And here's some female patients. So it looks like it could be possibly, well, look at this. It says in cimetidine 1.2 to 10.8 grams daily, mean 4.5, for taking 12 to 79 months. Well, our patient's only been on it 6 weeks. So it still looks like cimetidine may be linked to causing the gynecomastia. Then I would go back and I would type in doxazosin. Again, I would go to the detailed drug monograph, adverse reactions, endocrine, and I don't see anything listed here. So you would want to consider asking, what is the dosage form desired? What administration routes are feasible with this patient? What other special factors regarding the drug administration should be considered, such as is the patient fluid restriction, liver, kidney function, etc. So an example of an availability question is sotalol available in a suspension? So a nurse from the critical care floor calls, and the patient who is currently receiving sotalol oral tablets 100 milligrams twice daily is unable to swallow the tablets. So what do you tell the nurse? You want to go to the drug monographs and look under the product information list. So again, in facts and comparisons, I can type in sotalol. And if I look under product list, this will tell me how this medication comes. And I can see that it comes in tablets and then an intravenous solution that has been discontinued. So what I want to know is if the product comes, if there's a recipe for a solution. So I would take a look under, what I would recommend is to show all. So right now, all these are just the topics, just the titles are showing. So if I click show all, everything will show. And then what I would do is search. I would use my Control F, and I'd probably search for extemporaneous. But that did not come up. So then I would search probably for solution or suspension. So I notice now, as for suspension, preparation for administration, a 5 milligram per ml sotalol syrup may be made with the tablets in simple syrup. So I could tell the nurse that yes, we can make an extemporaneous suspension for that patient. If I go back, I can see that this was under facts and comparisons in the administration and dosage section. So for disease information, you have several options of databases to choose from. I'd recommend going to UpToDate and Dynamed. They will provide you with summary monographs on the disease conditions. The other source I put in here is the Merck Manual of Disease and Diagnosis, which is available through StatRef. So the next time you're in StatRef, take a look at the Merck Manual of Disease and Diagnosis. This resource will provide you with brief description of the disease states, whereas Dynamed and UpToDate are much more in-depth. You will often get questions about dosing and administration. You need to know patient specifics before recommending an appropriate dose or route of administration. You may want to consider asking the following questions. What disease is being treated? What is the extent, severity of the illness? What drugs is the patient receiving? Does the patient have any insufficiency of the renal, hepatic, or cardiac system? For drugs renally eliminated, what is the serum creatinine, BUN, and or urine output? Is the patient receiving dialysis? For drugs with hepatic elimination, what are the liver function tests, bilirubin, and or albumin? You also need to consider the patient's weight and whether the drug is a dose per ideal body weight, actual body weight, or adjusted body weight. For questions about administration, you may want to consider asking what dosage form or preparation is being used. What is the dose ordered? What is the clinical status of the patient? For example, if it's an IV medication, can the patient tolerate an IV push of so many mLs? Is the patient fluid or sodium restricted? Does the patient have congestive heart failure or edema? What possible delivery routes can this patient tolerate? And what other drugs is the patient currently receiving? Are any of them by the same route? So an example of an administration question is, a nurse calls the pharmacy satellite and asks if Cadian capsules may be open and given on a soft food. You ask and find out that the patient's having trouble swallowing. What response do you provide? Well, let's try LexiComp for this question. So again, I would type in Cadian and bring it up in Lexi Drugs. And I would go down here to Administration and Storage Issues. And then under Administration, I can see that it says, do not crush, chew, or dissolve extended release drug product, swallow whole. Cadian may be opened and sprinkled on applesauce and eaten immediately without chewing. So, Cadian may be opened, sprinkled on applesauce, and given immediately to the patient. So other things to consider for dosing questions include, for those drugs with serum level monitoring, what are the most recent levels for timing relative to the dose and the results? What is the patient's age, weight, height, and if creatinine clearance or body surface area is needed? Are these lab values recent? Is the patient's condition stable? Does the patient have a known factor that could affect drug metabolism, such as an acidylator status or ethnicity, such as an Oriental patient? So a question about dosing. A nurse practitioner calls your pharmacy and asks about the maximum daily dose for atomoxetine for ADHD in an adult who has liver dysfunction classified as Child-Pugh Class C. He is not receiving any other medications. What information do you provide? So let's take a look in facts and comparison. Atomoxetine So I classify this as a dosing question. So I want to go under administration and dosing. And I'm going to look for dosing in hepatic dysfunction. And I know I first have in the dosing section adult normal dosing. I have then child dosing. And then I get into renal dosing and hepatic. So here's hepatic function impairment. Mild hepatic, Class A Child-Pugh. Well, he's Class C. Severe hepatic impairment. All doses should be reduced to 25% of normal. And then if I click on the number 1, I can see that straight from the package insert. Now, if I was unsure of what does it mean by 25% of normal, I can look in lexicon. Atomoxetine. So again, in LexiComp, I go under dosage, and I'm looking at hepatic. All doses should be reduced to 25% of normal. So again, this is the language taken from the package insert. So if you're still not sure what is meant by 25% of normal, does that mean that I give the normal dose but I subtract 25% of that normal dose? Or does that mean that I give the normal dose and I subtract 75% of that normal dose? You can get a little clue by looking at the moderate impairment. All doses should be reduced to 50% of normal. So I know that in a more severe liver impairment, most likely this would mean the normal dose minus 75%. So maybe we go back and we look at the normal dose. 40 milligrams per day increased. May administer a single daily dose in the morning and late. May increase to 100 milligrams per day in 2 to 4 additional weeks. Maximum daily dose is 100 milligrams. So for this patient, his maximum daily dose should be 25 milligrams. For drug class reviews, I like to use facts and comparisons, and you can also use Dynamed and UpToDate. I will be going over drug class reviews in just a moment. It goes along with our drug interaction question. So drug interactions are defined as the effect of one drug on another to amplify or diminish its activity and clinical response. Two mechanisms exist by which drug interactions occur: pharmacokinetic and pharmacodynamic. We know that pharmacokinetic interactions are those in which one drug alters absorption, distribution, metabolism, or excretion, ADME, of another, thereby leading to a change in serum concentration. Pharmacodynamic interactions, on the other hand, are those in which one drug changes or adds to the intrinsic action or pharmacologic response of another. So if a drug interaction is suspected, there are several questions you want to ask. So if the interaction has occurred, what events suggest that this interaction occurred? For the drugs in question, what are the doses, volumes, concentration, rates of administration schedules, and length of therapies? Has the patient received this combination or a similar combination in the past? Other than the drugs in question, what other drugs is the patient receiving? When were these started? So here's an example. A physician wants to know why this patient's LDL decreased from 92 milligrams per deciliter to 17 milligrams per deciliter. The patient has been on Zocor for the last 2 years with LDL levels between 90 and 100 milligrams per deciliter. The only change of therapy was the addition of nifazodone a few weeks ago. To be safe, you decide to change the simvastatin to another agent. Which statins are the best choice for this patient? So again, this is a drug-drug interaction. So let's just double check by putting in a drug interaction tool, and I just chose facts and comparisons. And we want to put in simvastatin and nifazodone, and then hit the go button. Oh, and we can see drug-drug interaction appear. Again, I click on the hyperlink to get the document. This is a significant drug interaction. It is delayed. It's major. Documentation. It's suspected. The risk of myopathy and rhabdomyolysis may be increased when simvastatin and nifazodone are co-administered. The mechanism is inhibition of CYP3A4 by nifazodone may decrease the metabolic elimination of simvastatin. The management statins that do not rely on CYP3A4, like pravastatin, may be acceptable. And then it describes some case reports in which this interaction has occurred. So now I was asked to find out what statins would be acceptable. So what I want to do is find a class document that reviews all the statins. So I know Facts and Comparisons has class documents. So in the search field, I type in simvastatin. And what I'd like to show you is these folders up here at the top. Simvastatin is an HMG-CoA reductase inhibitor. So if I clicked on that folder, I will get up a class document for all HMG-CoA reductase inhibitors. And if I show all, you can see I get links to drug comparison tables, products, indications, kinetics, monitoring drug interactions, and adverse events. So here's an example of the class monograph for the products. You can see I have all the statins at the top, and down on the margin here I have the trade name, dosage forms, initial dose, maximum dose, combination products. So I can compare them side by side. I also here have indications and kinetics. And here I can see metabolic enzymes, and I can see the statins that are eliminated by CYP3A4, which I don't want to choose. So it looks like I have pitavastatin, and then the monograph for the drug-drug interaction mentioned pravastatin, potentially rosuvastatin are the three options. So to double check those, I could go down to drug-drug interactions. And this is going through the adverse events, pregnancy and lactation, monitoring of these medications, and then drug interactions. So this was a drug interaction with nifazodone. Nifazodone may inhibit the metabolism of CYP3A4, increasing the toxicity of void. Co-administration with simvastatin is contraindicated. So it looks like the three I want to avoid are atorvastatin, lovastatin, and simvastatin. So I could tell the physician that this patient could potentially use pitavastatin, pravastatin, or rosuvastatin. When answering a question about drug of choice, you should find out if there's a patient involved. And if there is a patient involved, you will need all the pertinent patient information. Questions you can consider asking are, what do you want to treat? What medications, including dosage and routes of administration, is the patient receiving? What are the patient's comorbidities? What are the patient's specifics, age, weight, height, gender, organ function, dysfunction? Has the patient received any drug previously? Was the response similar? Has the patient been compliant? What is the patient's name and location? What alternative therapies has the patient received? Was therapy maximized for each of these before discontinuation? What other therapies are being considered? What monitoring parameters have been followed? Serum concentrations, clinical status, other clinical lab results, objective measures, and subjective assessments. What is the patient's name and location? For questions about herbal or complementary and alternative medicines, you can consult the Natural Medicines Comprehensive Database, but also know that Lexicon, Facts and Comparisons, and Micromedics all contain herbal products. Facts and Comparisons has a natural products database in it, which is pretty comprehensive. The Micromedics contains all drug decks, which is not as comprehensive, but is available to you. And then Lexicomp links to Facts and Comparisons Natural Products Database. For questions about identification, you would want to make sure that you understand whether it's identification from the physical description of a tablet or capsule, or if it's identification from another product, such as a foreign drug product. So if it is identification from a specific product and markings on the product, you'd want to make sure you understand whether or not the patient is looking at the tablet or the nurse is looking at the tablet. And if so, what is the dosage form, color, markings, and size? And is everything visible? If you don't have the tablet in hand, or the patient or the nurse does not have the tablet in hand, you want to ascertain the source of the information, and was it reliable? What is the dosage form, color, marking, size, etc.? You also want to ask if anyone in the family or yourself, the patient, is taking this medication, and if so, for what? And under what circumstances was this product found? Who found the product? So an example of an identification is, you're working in a hospital, a nurse calls the pharmacy saying she'll be coming down to the pharmacy with some tablets for identification. They found the patient taking these tablets by his bedside, and he was very defensive when approached to ask what these tablets were. There was a blue tablet, was round with the markings of myelin A1 on one side, and the other was scored in blank. The brown tablets had a marking of OP on one side and 30 on the other side. The best source to use for tablet identification is Micromedics. Micromedics has Identidex in it, which contains the most medications in it compared to Facts and Comparisons and Lexicomp. So what you want to do here is click on the drug identification, and on side 1 you want to write what it appears. So I have myelin A1 on side 1 and side 2 is blank. So then I want to hit the search button. And I can see that the imprint comes up, myelin A1. It is Alprazolam by Myelin Pharmaceuticals. So if I click on the drug name, I will get a description of this product. And I can see that it's blue, it's a circle, the imprint is myelin A1, and how it comes, the NDC numbers, I can get a description of the excipients. It's Schedule 4 in the United States. Identidex also has Canadian products in it and other overseas products. So again, I can modify identification and put in the second product, which is an OP on one side and a 30 on the other side. And I know this is brown. And I can see that this is an OxyContin tablet. So again, if I pull it up, I will get a description of this tablet. It's a 30 milligram OxyContin, has OP and 30 on one side. It's extended release. And I even have a photograph of what this looks like. So again, Identidex is the best, but Facts and Comparisons and Lexicon both have identifications in them. So if you need to, or if that's the only resource you have, please, by all means, use Lexicon to identify. One of the best sources to look foreign drug medications up in is Micromedics. Micromedics contains Martindale's, the extra pharmacopoeia. So what I do is I just type in the brand name into the search field. And I can see over here to the right, I have a toxin drug lookup, a Martindale's lookup, and a Red Book lookup. And I also get a listing of Lacomed Global, and the generic name is lectidipine. So I'm going to choose this Martindale's Lacomed. So again, I want to choose the related documents, lectidipine, and it brings me to Martindale's. I can see that it's under cardiovascular drugs, lectidipine, and the proprietary names. And Martindale's here is organized alphabetical by brand name, and it will tell you the company and then the country of origin. And then adverse events, I'm just thumbing through to see what it is. Oh, it's a dihydropyridine calcium channel blocker like nifedipine. So I know that in the United States we do not have lectidipine, but we do have nifedipine. So at least I can tell this physician that Lacomed is lectidipine and is a dihydropyridine calcium channel blocker like nifedipine. So I do recommend you use Micromedics because it does contain Martindale's. Lexicomp also has international brand names in it. And you can certainly use Lexicomp if you do not have Micromedics available to you. Now the second part of this question, is it appropriate to use nifedipine for migraine prophylaxis? And again, if I wanted to research this part of the question, I would go to one of my disease evidence-based medicine databases such as UpToDate or Dynamed. Answering a question about an indication often involves non-FDA approved uses. Remember that when a drug is approved for market by the FDA, the prescriber can use the drug for any indication. Again, you need to find out if there is a patient involved. If there is a patient involved, you will need to find out patient-specific information. Other questions to consider asking are, what is the disease or condition you are treating? What medications, including doses and routes of administration, is the patient receiving? What are the patient's comorbidities? What are the patient's specifics, age, weight, height, gender, organ function, dysfunction? What patient parameters have been followed, such as serum concentration, clinical status, lab values? What is the patient's name and location? For questions regarding inert ingredients, I recommend again going to DailyMed to get current package inserts. However, you can look up inert ingredients in Facts and Comparisons, Lexicon, Micromedics. All of this is found under the product information section that we reviewed when we talked about availability. So for example, what dyes does Zoloft 25 milligram contain? So for this example, I'll use Facts and Comparison. So I just type in Zoloft. And again, I want to go to the product list. And I can see that Zoloft comes in a 25, 50, and 100, and an oral concentrate. So I'm going to click on the 25 milligram tablet entry. And it brings me to another screen in which I have labeler information on the 25 milligram. I'm looking for the brand name product. So by Pfizer. And I can see here under other information that it lists other dyes. So it contains FD&C red number 40, FD&C yellow number 10, FD&C blue number 1. I can click on the picture to get more information also. And I get a description of the Zoloft 25 milligram tablet. When a drug is investigational, this means the drug has not yet been approved by the FDA. Indications can also be investigational, but remember that once the FDA approves a drug, physicians and prescribers can use that drug how they see fit. When answering a question about an investigational or orphan drug, you will need to find out if the caller needs a drug for a patient or if the caller is simply interested in more information about the drug. Questions to ask include, why do you need this information? Is the patient in need of the drug or currently enrolled in a protocol? Why was the patient receiving the drug? What is the response when the patient was on the drug? What are the patient's pathologic conditions? If a drug is desired, what approved or accepted therapies have been tried? Was therapy maximized before discontinuation? So one of the best places to look for orphan and investigational drugs, besides all the drug databases which do contain this information, is directly from the FDA. And I have listed a hyperlink there for you. When answering a question about IV compatibility, you need to determine exactly how the IV medications will be administered, the diluent, the concentration, and other available administration routes. Questions to ask include, what is the intended administration route for the patient's medications? What type of IV access does the patient have, peripheral or central? Is the patient on a central line? Does the patient have a single, double, or triple lumen? What are the doses, concentrations, and volumes for all pertinent medications? What are the infusion times, rates expected or desired? What is the base solution or diluent used? Is the patient able to receive the parenteral medication intravenously, intramuscularly, or interosseously? Are the medications to be mixed into one syringe or given through the same line? If they are to be given in one line, what type of IV access does the patient have? Does the patient have a peripheral or a central line? Does the patient have a Y site, a single, double, or triple lumen? This is an illustration of IV access. On the left, you can see a peripheral line, and on the right is another peripheral line with a Y site. So again, it's very important to determine whether or not the patient has a peripheral line, a central line. If the patient has a central line, whether or not the patient has a single, double, or triple lumen. Types of IV incompatibility. When two drugs are given together in the same line, incompatibility can be either visual, can be chemical, it can be compatible, or you can have a solution instability, which you get a precipitate. You also need to know the resources and parenteral drug preparation characteristics. Let's go through an example. Is midazolam IV push compatible with a heparin drip? You are working in the satellite clinic on the critical care floor, and a nurse calls asking if she can give midazolam IV push 2.5 milligram per ml, total of 5 milligram, with a heparin drip that's going at 160 units per ml at 2 mils per minute in D5W. And we know the patient has a double lumen central line. So you can use all of the databases, Facts and Comparisons, Lexicom, or Micromedics. For this example, I'll use Micromedics. So again, I want to go to Trissel's 2 IV compatibility in Micromedics. Facts and Lexicomp also have Trissel's 2 IV compatibility. So I enter my search term, midazolam. I just hit enter, and I wanted to show you what I get. So first thing I want you to notice is this little icon. This is product document for midazolam. So if I click on this, I will get information about IV midazolam. I will get the pH range, the formulation, osmolarity, sodium content, which can be very important if a patient is sodium restricted or fluid restricted. You can get stability information, extemporaneous injections, pH, any information about interactions with plastics and if a filter is needed, any information about freezing or effects on light, and then other information. And then lastly, all the references. This is a very excellent source of any type of IV product information. And again, I just got there by clicking the icon located to the left of the drug name. You can see the tabs here by solution, Y-site, admixture, syringe, and TPA. So I would like to go back though and put in midazolam, which is already checked, but also to see heparin. So again, I hit the arrow and then I click submit. And then the interaction specific to heparin and midazolam comes up. What I need to do at a Y site, I need to click on the drug pair to get more information. So I know it's compatible, but I need to check the concentrations to make sure they match what I have. I can see that heparin at 160 units per ml in D5 is compatible with midazolam 2.5 milligram per ml in D5. That physically compatible. No changes in measured haze, turbidity, particulates, or color were found. I know the study period was 4 hours. If I wanted to find out more information, I could click on this reference number, and I can see that this was a study done by Lawrence Trissel. Again, make sure you page down just to double check. And pretty well these two are compatible. at the Y site. Admixture means that they're mixed in the same bag, and you can see it was not tested. And syringe means heparin plus midazolam in the same syringe. And I can see that this is incompatible. Now, of course, this heparin was much more concentrated at 2,500 units per 1 ml. Okay. But you can see that if added to midazolam, 3 milligrams, 5 milligrams per ml, that it's physically incompatible. Turbidity or precipitate appears within 5 minutes of mixing. So again, the Tristel's 2 IV compatibility tool in Micromedics, it's also in Lexicomp under IV compatibility. Tristel's check. And Lexicomp will bring you actually to FACS because the same company owns both databases. So again, I just do the same thing. I would want to make sure that my tab up here is check compatibility. And at a Y site, and it's asking you for the vehicle and the drug. So the vehicle is going to be the solution, like D5. I get the same drug properties as I did with Micromedics by clicking on the Drug Properties tab. So I could tell the nurse that midazolam can be given IV push through a line with heparin. So for questions about over-the-counter medications, the university does have the Handbook of Non-Prescription Drugs, and this is found through the pharmacy library. You can also look in Facts and Comparisons, Lexicomp, and Micromedics. All 3 drug databases contain information about over-the-counter medications. For questions about pharmaceutics, you would want to determine if a patient's medication was involved, or if the caller is just asking because they're curious. So again, you need to know why they're asking the question. What medication is in question? How was the medication stored and for how long? When will you need the medication? Was the product stored in the refrigerator at room temperature? And if so, for how long? Was the product exposed to sunlight? If so, for how long? Was the product frozen? If so, for how long? And when was the product compounded or prepared? For questions about pregnancy and lactation, one of the best sources to use is Facts and Comparison because it contains information from Briggs, Drugs in Pregnancy and Lactation, which is one of our gold standards for finding information about drug use in pregnancy. You can also use Micromedics. It has some very good databases. LactMed is in Micromedics. But you'd want to find out more information from the patient. What is the drug the patient received, the dose and the duration? How old is the infant and how long has the infant been breastfeeding? Is bottle feeding an alternative? What is the frequency and milk volume of breastfeeds? How often does the baby feed? Does the mother have hepatic or renal insufficiency? What was the indication for the prescribing drug? Was this the initial or alternate therapy? Has the mother breastfed previously while on the drug? For questions about teratogenicity, you want to ask about the same types of questions. And you definitely want to find out if there is a patient involved. So in conclusion, when answering drug information questions, it is important that you understand as much as possible about the clinical situation. This will help you decipher the clinically important information from the databases. You will also need to know where to look for an answer. Using a systematic approach and knowing the differences in the references will help you in providing an appropriate answer in the most effective and efficient way. Answering drug information questions is like a puzzle in which you are trying to determine the best solution for all the pieces to fit together in a timely fashion.